schools and businesses in Nevada and Placer counties.
To another edition of Nevada County Interviews. I'm your host, Paul Minicucci, and tonight we're going to be talking about traumatic brain injury and pediatrics. That is, of course, traumatic brain injury as it relates to younger people. This is the fourth in a series of shows that we are going to be airing here at NCTV about TBI. So with me on the set we have two physicians actually, and two parents, among other things. Claire Eunice, pediatrician, thanks for coming. Ed Nemeth.
Thank you.
Laura Priest, and Michael Jensen. Welcome back.
Thank you.
And today we're going to want to investigate what it is that we mean by pediatric TBI, and perhaps talk a little bit about why it's so central to find and diagnose TBI early among pediatricians. How do you come about to get referrals, some of the barriers that you might face, and what are the treatment modalities you guys will see? So first of all, Claire, let me ask you, when we talk about pediatrics, what's the age group there?
Pediatrics generally, for our practice in any case, is defined as birth to age 21. Mm-hmm. There's some variation depending on pediatric practices. Some will stop at age 18. Others may continue on past 21. I believe Medi-Cal covers children till 22. So right. There's a little variation there.
And among children, of course, the brain is continuing to grow and to become more sophisticated, particularly in the frontal lobe area, up until what, age 22, 24, somewhere in that area?
Well, I think especially in males, we know that there's still development happening till age 25 or so.
Mm-hmm. So, obviously, when you're talking about a head injury with a brain that's still growing, it is all the more important, is it not, to be able to diagnose and treat that?
We certainly think so. There have not been enough studies on pediatric concussion. For example, in grade school children, we really don't know very much. But we do know that in high school athletes, that's probably the highest risk age for serious after effects from traumatic brain injury.
Right. And so is pediatric TBI, is there a subspecialty, or you just happen to be treating people because you have a sports-related practice as well?
I have an interest in sports medicine, but I'm a general pediatrician. Right. I would say that most people will find their way to their general pediatrician first. There are some sports medicine specialists, not very many in pediatrics, but there are some at referral centers, and they will be more versed in concussion. Some referral centers have actually opened concussion-related specialty clinics because of the difficulty in getting enough attention or appropriate attention, especially in a child who may have had more than one traumatic brain injury.
Do you find, of course you deal with younger people all the time as a matter of practice, but do you think younger people tend to hide brain injury, or they're not aware of it more often than older people?
Certainly, and that is the nature of pediatrics. Obviously, we're often trying to infer symptoms and understand what may have happened by guessing a little bit or needing to ask a lot of parents in terms of understanding what a child's history might be. Speaking particularly of younger children, the symptoms of concussion can be so varied and so subtle. So we can often have a child who may show up with attention problems or learning difficulty in school that presented much later than is typical, for example, for attention deficit. And if we don't think to ask those questions about head injury, that certainly could be missed. Older kids more commonly are going to report their injury or will have more definite injury that we can speak to. They know, for example, or parents know they fell off the ATV or they had an injury playing football. And so I'll be more likely to see the older adolescent or the older kids in adolescence for an actual known head injury.
So when I'm a 12-year-old kid and I'm playing football, let's say in Pop Warner, or I'm a freshman, and I get what I think is a concussion. I did lose consciousness, but I was dinged up a little bit and hazy. And I come to you. What kind of questions do you ask of the kid or the parents? I assume the parents are going to be with the child.
Absolutely. So asking about the symptoms of concussion, which certainly can be what you described, sort of being a little bit hazy or acting a little bit out of it, but they can be much more subtle. It can just be, has your child been more tired lately? Have you had more headaches lately? Any dizziness or seeming to be more off balance than usual? Sleep problems can be part of it. Kind of the categories of symptoms with concussion are broad. There's the physical symptoms like headaches and soreness. There's emotional symptoms. Just being irritable can be a symptom of concussion.
Which is sort of like being a teenager to begin with.
It is tricky. Absolutely. No, you're not incorrect in that. Sleep symptoms are absolutely part of it. And then cognitive function. So how well are they doing in school, or has there been a real decline? Are we suddenly doing poorly where we were doing fine before? So there's kind of those four categories that we need to address if there's been a head injury to find out how well it transfers.
And then what would happen? Would you, let's suppose you determine that this is a moderate concussion. What's your next step? Would you refer this person to a specialist?
Typically not. Typically the most important first step is to discuss with parents what concussion is, that it's not that there's something we're going to see on a CT scan and there's something wrong you can see inside the brain, but it's a functional problem. And for that functional injury to resolve, it really requires rest. The hardest thing is making sure that rest isn't just rest from sport, but it's also rest from having to use the brain too much, thinking too hard. Even computer games can be too much work if there's been a concussion. Right.
And Laura, we're going to be talking about that with you, because there certainly are implications in terms of a person being a student and getting approbation from the school to actually allow your student to rest.
Right.
Yeah. So is there any time at which you would interact with Dr. Jensen, who's a physiatrist?
I haven't. I've never met you before, but very nice to meet you now. Not typically in my practice. Up to this point, most of what I have done involves making sure that restrictions are being placed on activity level, on schoolwork if necessary, and making sure that the rest is happening. That's usually my main role as a general pediatrician when I see concussion.
Now, one of the more difficult things in terms of TBI among young people is shaken baby syndrome. It's very difficult to know because, of course, the person is not aware of that, and the parents have every reason not to want to tell the doctor exactly what happened. Do you see any of that? And how do you know that that's what's going on?
I think every pediatrician hates to think about cases that they may have missed of any kind of child abuse. Shaken baby most commonly presents as a child whose level of consciousness has changed or who's having seizures or something that's more dramatic, and they more commonly are going to present to an emergency department, to be completely honest. And that, by definition, is because we're seeing a baby. If, however, I'm seeing a baby who has developmental delays, if they're not progressing normally in either their motor development, their language development, or fine motor, then I'm going to be referring that baby. And depending on the age, that may mean I refer them straight to a neurologist. Or it may mean that we're just going to try to work with Alta Regional Center, get some therapies in place. Level of suspicion, obviously, is going to play a role there. But often the neurologists are really our main support in helping determine if more evaluation is needed or if this is just a baby who's not developing at the same rate everyone else is. And certainly everyone's an individual, so that can also happen.
So I'm going to turn to Dr. Jensen and ask you, how much of your practice is involved with people up to age 18?
My biggest population that I see is probably the teenage group. Once they hit junior high, high school, that's where I tend to get more of our referrals from. It's wonderful to hear a primary care physician like Dr. Yunus talk about all the different things that she looks for with a brain injury. But unfortunately, I think primary care has an incredible task of knowing a little bit of everything in all different fields. And there's not a lot of primary care physicians that have the experience and dealing with concussions as much. And so oftentimes I get the referrals at a stage that comes when things aren't going quite right. They're not recovering typically what would be expected with just rest, and so they will send over for a referral for further evaluation or further look at, are we missing anything else? Is there something else that might be going on? And that's oftentimes when I see the youth. Or from a sporting event, people will come directly, but oftentimes most of the referrals come through primary care.
Let's talk a little bit about this whole issue of concussion and TBI, and is every concussion a TBI, or how do you make that distinction?
That is probably the biggest misnomer I think that we have is people think that a concussion is not a traumatic brain injury, and I think I've shared it with others before. I had an athlete who I had known had 3 concussions, and we were walking out after he had had another concussion after a sporting event, and I mentioned, with that traumatic brain injury, and he quickly looked up at me and clarified, I haven't had a traumatic brain injury, I've just had a concussion. A concussion is defined as a mild traumatic brain injury, and I think that's really important for people to understand. And that helps kind of put the importance that needs to be applied towards a mild traumatic brain injury. And a majority of mild traumatic brain injuries all can settle down on their own with appropriate treatment, length of time, evaluation, making sure we're not having any residual effects going on. But there is always a subpopulation that does not respond typically. And that is where they need further follow-up, further treatment, and further diagnostic. Not so much from an imaging standpoint, but from where we talked about before with the neuropsychologist and speech therapy.
So is diagnosis of TBI mostly symptomatic because doesn't always show up in a CAT scan or a MRI, for example?
Absolutely. Mild traumatic brain injury is made more on the diagnosis of the symptoms that occurs, because most imaging studies, if they're considered mild traumatic brain injury, are negative. So oftentimes if they had a loss of consciousness, they've already been to the emergency room and oftentimes had an evaluation with at least a CT scan to rule out a major bleed within the brain. And then oftentimes they're sent home, follow up with primary care, and usually they do well. But it's when those symptoms linger on and or they're not recognized that then problems develop. And then oftentimes the parents don't recognize it, the youth don't recognize it, they don't know why they're irritable, they don't know why they're not doing as well at school, why am I not sleeping as well, they're just not as cooperative,
Right.
and a teenager. And so,
Right, and we're going to see an example of a film of 2 twins where one of the twins, Kelsey, got hit in the eye, orbital fractures at age 12, and the TBI never came up until she was in college and actually was getting diagnosed. And finally, because of the symptoms that she was facing, and we'll see more about that. Now, do you think that some people refer to head injuries versus traumatic brain injury, and we were talking off camera a little bit about that with some of our folks, saying that when you hear a head injury, that doesn't sound quite as drastic as a brain injury. Do you run into that?
absolutely. I think we all have had, if we're active, we'll have hits to our head that, we may not have had any residual symptoms, we may not have even had any mild symptoms, but there's a whole field where we are renaming a condition that can be preventable that is called chronic traumatic encephalopathy, and that is believed to occur because of hits to the head that may have not shown any concussion symptoms at the time, but they have been repetitive. And they're finding that there are biochemical changes within the brain that then set up problems that youth and then as we get into adulthood occur for a lifetime.
Right.
And so it's very interesting that we are starting to pay attention to this. And I think a lot of it has been because most of the study of brain injury has been with adults, and we're now starting to recognize that the effect is much more with or different one with the adolescents.
How are they different? How do you treat a pediatric situation differently than an adult?
Well, as we discussed before, pediatrics are still in a developmental stage, and so I think an awareness to deficits is harder for an adolescent to pick up, and more so for an adult to evaluate an adolescent with also. Whereas when you have an adult, people are used to their behaviors. This is the way they act all the time. And so with an adolescent, it is much more concerning to recognize that there are changes that are occurring and that they are not back to baseline. And I think that's part of the important stage with adolescents that medicine's starting to go towards, is getting more baseline information from a cognitive standpoint early on. We can then evaluate when we've had injuries to go back to a baseline study and say, wow, there's a difference here.
Right. In fact, yes, go ahead.
And some sports teams are starting to do that.
Right.
So, and you probably are aware of that as well.
Right.
But it is something we are trying to push for, as well as having sports teams start and, have everybody on that football team have a baseline neuropsychiatric test done. There are computer-based ones that people can access themselves to get a baseline, because that's really critical in finding out when someone's really back to baseline. How do you know if you never did that first baseline study?
Yeah, exactly. And we were talking off camera with Cindy Shaw, who's been advising us on all of this, about the fact that there is no early baseline, and so, particularly pediatrics, it's difficult if, something happened at age 6 and it was missed or misdiagnosed. The behavior at age 6 seems to be, endemic to that person, and so nothing's unusual about it, when in fact that could be a
We tend to
TBI.
overlook it. They're just developing.
Exactly.
They're
Right.
changing. I think in the years to come, there will be a standard that every year, just like the kids go through pre-physicals, that there will be baseline neuropsychological. And I think we'll get better with the test, and I think the test will be to where they're not, right now you can do a test in 15 to 20 minutes, which is a good basic neuropsych test. But I think there are already tests that are coming off that are 5 and 10 minutes, and those, some that are free, some that are being charged for it. Companies, need to make money for their testing with what they do. But I think we will come to the day with, just like you need a pre-physical, that we will recognize the importance of the brain as much as we do the joints and everything else that we test.
Now, some people have asked Dr. Eunice that, people who are going to engage in a sport like football, maybe even soccer, where repeated blows to the head occur, that parents be asked to sign some kind of statement that they really understand that that the danger that your child is under here. Is that something that you would say would be reasonable or feasible in the future?
I certainly think it's reasonable. I do think that there is a lack of understanding on the part of parents as to how serious a brain injury can be, especially if we just call it concussion or a bonk on the head or something like that. I think a reasonably strongly worded release is not a bad idea. I'm not sure it will really change things for everybody, but I think it's worth putting it out there and giving people more information. I do think that there's a lack of education about the risks of concussion, and that needs to be.
Some attorneys have told me that it might not be a good idea, because what it does is it may be an incentive for people like football coaches to say, well, the parent was really well, and this follows like the tobacco industry, which I spent half of my career battling, and that is what, in fact, what the tobacco industry did, was to try to force FDA regulations so that they could get out of liability, saying, well, the person knew, and it's regulated by the government. What do you expect us to do? So that's a double-edged sword. So let's see. If a person comes in and they show some symptoms, again, let's say it's a 10-year-old and they're having sleep disruption, how high up on the question trail does TBI come into play? I mean, when do you say, have you had a recent head injury, or have you banged your head lately?
I think it's going to depend a lot on parental concern. As so much as in pediatrics, we really rely on parents to guide us in terms of how much of a concern this is. If a parent comes in and says, oh, well, even when they were a baby, they had trouble sleeping, and so this is going on, I'm more likely to pursue whether something stressful has happened recently, if there's something emotional going on, than I am to pursue brain injury. But if a parent comes in and says, he's always been a really good sleeper, and this is brand new, and nothing's really changed, and, we can't figure out what it is, then it's going to move up on the differential much faster.
And in some fact, a lot of people are suggesting now that a lot of attention deficit disorder may in fact be, symptoms from a brain injury. Do you think that's true, or? or not so true?
That may be overstated, but I don't know, honestly. I don't know that we have the study to show it. We do know that a fair number of kids who are diagnosed with attention deficit truly have sleep disorders, and we know that disordered sleep can absolutely cause the symptoms of attention deficit disorder. So we definitely, in an evaluation for ADHD, will discuss sleep. I'm not aware of a study that shows a significant proportion that are related to traumatic brain injury.
Well, the reason I bring it up is we've been looking at a lot of studies coming out of the military where a lot of PTSD, is actually traumatic brain, and in fact, both can occur in a fair number at the same time. But it's really hard to separate out symptoms that look like different diseases and disorders. So
I think you're correct, and it's something that we need to do more, but it hasn't been standard of care to now.
Well, now I'm going to shift the conversation to you, Laura, and I'm going to ask you. You have a history with your daughter who has sustained TBI and yet was able to be valedictorian of her class. Tell us your story.
My daughter Kate, when she was a freshman at NU, suffered a traumatic brain injury. It was her second concussion in 6 months. She had been working for a friend of the family's and riding an ATV without a helmet, like you mentioned. And nobody knows exactly what happened. We are aware she took out 2 trees in the accident. She was taken to the hospital, and very, in my opinion, very kind of cursory, just go over things. She'll be fine in a day or 2. She had left side body tremors, which were consistent. One eye dilated more than the other, but we were sent home and told it was a Saturday, that Monday she could probably go back to school. We took her home. To us, she was unresponsive. She wouldn't answer questions we asked her. We ended up taking her back to the emergency room again the next day. They had done a CT scan the day before. They did another one, said nothing was showing up. Maybe she'd have to stay home a day or 2 from school. Anyway, we didn't know much else what to do. Through a series of events, we were given Mike Jensen's name and had an appointment with him, I would guess a month or so after her injury. She had been a really, really brilliant, outgoing girl, and had a lot of, to us, interesting kind of side effects, which agoraphobia was one of them. Very much afraid of being even outside the home.
Was that because she was afraid that she wasn't going to remember conversations or people's names?
There was an element of that, especially as it progressed. Initially, I think it was instinctual, that she just was not comfortable. When Mike was talking a minute ago, I was laughing. One of the ways he knew that she was getting better was she would move a little further away from me when we would have appointments. I don't remember that.
Yes, I do.
When he first walked in, the first one, she actually had her legs draped over my lap. She physically needed to be right there with me.
Yeah, I remember
that.
Yep, I do.
And in your case, the school was an issue.
It was a big issue.
Tell us about that. What happened when you asked for special accommodations
for her? We were given a gift in that we had been referred on to Cindy from Mike, and they told us that she needed to be pulled out of school. She could go up maybe for 1 class, maybe take 1 home study. So when we approached the school about it, they were very resistant. One of the problems was they didn't want to acknowledge that a concussion could have a lasting effect. We were told, quote, "Kids get over this in a week or 2, therefore you must be exaggerating the problem."
Did the term traumatic brain injury ever enter the conversation?
It did from our end because it was diagnosed as mild. They kind of equated it the same way you'd say someone has mild allergies. It wasn't considered to be serious in their eyes. They did not like to accommodate our problems. Eventually, we fought hard enough and long enough that they would allow her to have, say, open book tests because she couldn't retain things that she was learning.
And she didn't have tests without time limits. I mean, she was subjected to the conditions that a regular child would get.
Until we asked for more and actually insisted. And then she, her sophomore year, went to school half-time. And we had a really worthwhile experience with her home study teacher, who was Wendy Reeder, Dr. Reeder's wife. She was very compassionate because she had that medical background herself in dealing with her, and made it work for us. The higher-ups in the school were not as interested in doing that for us. We had a few run-ins.
You know, I think it's really important to understand that if she didn't have a mother that advocated, she wouldn't have gotten most of what she had.
Yes, it's very true.
And it took someone who would advocate and trying to educate the school and educate people.
Right, and that's why it's so important. I think the reason we're doing the show is because if parents don't know what TBI is and symptoms are, they can't be confident in advocating for their kid. And, you know, I would venture to say a large, significant portion of TBI among, you know, pediatric goes unnoticed or underdiagnosed or, you know, or just shut it off. You know?
Like Laura said at the beginning, you know, people assumed this is mild, this will, you know, most people improve, so you're exaggerating. And here's a teenager, you know.
And she looks fine.
And she looks good,
yep.
yeah.
Right.
And what do you mean she doesn't have endurance? She looks just great sitting in that chair jumping around, you know.
Right.
So it's...
So tell me a little bit about Kate's issues, social, you know, the sociology of it and her social life. What happened?
It became very isolated for her. Being 14, most of her friends couldn't understand what was going on. She wasn't visible to them day to day, so she lost virtually every friend during that period of time. I would say most adults were uncomfortable associating with her. She didn't necessarily respond what you would consider normally in situations, give 1 or 2 word answers rather than speaking. She'd been a valedictorian at Seven Hills and an athlete, and she went from that to having to give up most competitive sports. And she still did graduate valedictorian from NU, but focused so much on doing well study-wise, she gave up any social life whatsoever,
And
which she was comfortable with.
And now she's at BYU, and
Yes.
and this is a little bit different for her, right? I mean, she's for the first time away from her mom.
Right. we this new world with texting and, you know, everybody having a cell phone. We tease all the time that she's not really gone because we talk to her more now. But, you know, she was a really hard-working kid, and I think because of that, people just assumed because she did well academically that there wasn't a problem. And they didn't see the hurt. We were discussing earlier that she still has sleep issues. When she went off to college, the left side tremors came back. Flooding occurred, which is where her brain basically turned off. So, you know, those issues will probably be, I'm guessing, lifelong. Because anytime there's stress, they come back. And
Right. Which I think is another issue that we need to underline for parents is that, you know, the kids were responding by saying they're undergoing tremendous stress. We need to listen to them
Right.
because it could very well be true that in stressful situations are the ones that trigger, you know, these issues that you're talking about. And that as parents, we need to be able to guard our kids against having them get stressed out.
Right.
So what advice would you be able to, let's say, what advice would you tell parents? Because I know parents are often referred to you.
I think moms know what they're talking about.
Yeah. So if you have that gut feeling that something's really
she
wrong.
had a concussion 6 months before, and we had watched, you know, the couple of weeks of different behavior, of not doing well on tests. And when she had the second one, it just wasn't the same. We knew something was wrong. And everywhere we went, we were told, just wait, it'll get better. Just wait, it will get better. Until we went to see Dr. Jensen, and he was very proactive in our behalf.
Right.
And Cindy Shaw really made a world of difference for us.
All right. We're going to move now, if I can ask the folks in the control room, let me set this video up. We had the pleasure of meeting a family that has twin girls, and Kelsey and Carly, and they're very vivacious young girls and very smart, leadership-oriented. And at age 12, Kelsey had an accident with a golf club where somebody inadvertently hit her in the eye with a golf club. And what happened was, because she had shattered orbital structure, facial structure, there was several operations necessary to make her face better. And as soon as that process started, the TBI was simply not talked about at all. And so from age 12 all the way through the time she got into college, TBI was not discussed, or she was not diagnosed with it. And so we asked the girls to be able to talk a little bit about the situation. Being twins, they're of course particularly close, and you'll see that Carly actually considers the disease to have happened to her as well as to her sister. We're going to only show you the last 5 minutes of this tape because it was just too long to play the whole tape. We'll give you some sense about what it is that these young people are facing. So if we could roll that tape, I'd appreciate it.
Actually, I took 2 maths, which was algebra and algebra, just to catch up.
Yeah.
But it was hard for her. It was really, math was hard. I couldn't get it. Processing, I couldn't understand the equations. I couldn't remember the equations.
Yeah.
And it was a fight. It was a fight to math. So,
And I had to help her a decent amount. My mom and I both did on assignments. I remember some nights she's come home just so frustrated and yelled, "I'm stupid. I don't know how to do this. I'm never
I
gonna
can't
pass."
do it. I hate this. I can't do it.
Yeah.
But, I always pulled through, and I always got to see her better, which for me was fine because
Yeah.
math was never my strong suit. But
So then we started and we got through high school, luckily, and Kelsey and I decided to go to different colleges.
to be our own people.
Yeah.
And college is where I found out that I had some sort of traumatic brain injury because my mom insisted there was no talk that I was going to get tested, and so we had me tested through the school by a psychotherapist who was going to diagnose me for a learning disability because that's what we assumed.
No one ever said this kid could have
a traumatic brain injury. No one ever said that. So I did about 8 hours of testing, and it turns out that he said, I really don't think this is a learning disability. I think these are effects from her accident. And I was dumbfounded. I mean, duh. Like, why didn't we think about this before? Of course, this is why I'm struggling. I have an injury. And
So 2 classes you really struggled in college.
it was my first math class, and my professor, I would go in and I'd get help. I told him, I'm really just having trouble with this. And he looked at me and he told me, well, Kelsey, you can either study harder or you can drop my class.
And the thing is that people don't understand what traumatic brain injuries are. They don't understand that you don't have that side of your brain to process what you're supposed to be processing.
No.
So it was really difficult for Kelsey. And then her writing USM teacher also got on a case.
But yeah, in my high school we never did research papers, so I never understood how to introduce a source, and I was really struggling with learning how to do that within my paper. And within the paper, I apparently failed the format, and because I did that, she told me that I was a failure. I quote, "I was a failure to her peers." No, not a failure. Sorry, an embarrassment to her peers, and to the university because I couldn't cite or introduce my sources.
Yeah.
So, and that was really hard. I cried, and because she didn't understand. And when she said that to me, I turned to her and I said, "Dr. Boyson, I don't really see how you saying that to me is going to help me become a better writer."
Yeah.
So, and it didn't, and it just really hurt me. And no one understood because I looked normal.
And that's the thing with traumatic brain injuries is that the people look normal, That's why with all these football players and professional athletes and people who are in high-risk areas who do have brain injuries, even as little as concussions, they look normal afterwards, but you don't know the internal damage.
Never. And so people don't get it.
Yeah, since it's not an apparent disease or like something you're constantly publicly struggling with, people don't really consider it a problem.
Exactly.
So
And that was my experience, I would say.
yeah. I mean,
think-
it's going to be hard for the rest of her life,
Mhm.
And it would have been nice to know earlier. It would have been nice to have the attention that we needed on these injuries.
Exactly. And I wouldn't have felt so ashamed of who I was because I couldn't do the work. But not that I couldn't do it, but because I struggled so bad.
Yeah.
And it just, now I feel almost relieved. I now found out that it wiped out my math and my language. So
It's also bumped up her social, right?
Exactly. I feel like I'm more socially, even more so than I was younger,
Yeah.
just because I have to survive on those relationships to help me study. And
Yeah. And she also has a tendency to be more outgoing now, or just a little bit more, because that's something that when you have a left brain injury you do, you're less inhibited. So I think that in ways it's helped and hurt her. Definitely has made her stronger.
I definitely say, you know, it doesn't kill you, makes you stronger.
So anyway, thanks for listening.
That's our story, and I guess we'll see you later. Bye. Bye.
Even though the tape quality because of course you're dealing with very similar DNA here, and you can see how the brain injury really affected the one, in terms of social life as well as academic life. So we're hoping to have them on live at some point and come down from Oregon. So Ed, I'm sorry that we've kept you in here and listening. Ed is going to tell us that there is some hope and there is a treatment regimen that's really quite interesting and promising. But first, tell us your story about your daughter and how you got into the business with hyperbaric treatments.
Well, my wife and I had married a little bit later. We waited a little bit of time, established our businesses. When the time was right, we started to have a family. We had a perfect pregnancy, and somehow during labor, middle of labor, my daughters died in the womb, quite simply. They did an emergency C-section, got her out within 8 minutes, which I thought was unbelievable. Great that they could do that. And I watched the doctor resuscitate her for another 27 minutes.
Mm-hmm. Well, we're going to show some slides of Ed's daughter at various points in her life as we go along. So starting with her as a very small child and then finishing with her painting. And there she is.
She's about 3 years old. That's one of my more favorite pictures, although she has a lot of favorite pictures. But she was resuscitated on life support for 6 days and with a flat EEG. We had to make a decision, and it was a very difficult decision. And I wouldn't wish it on my worst enemy, but we decided that if she was going to pass, which was certain, that we wanted her to pass with us, out of love in our arms. And so we made all the arrangements and actually went in a room about this size, put her prettiest outfit on her, put a bow in her hair, and then the nurses removed her from life support. We told that in about 10 minutes she would pass, and she stopped breathing twice. The second time she actually passed again. And we held her. She had turned purple, her lips are purple and all that. And then I noticed, I don't know, I couldn't tell you how long it was, but her lips had turned pink. And I asked the nurse what was going on, and she said, I don't know. We held her for the rest of the day, and at 10 o'clock that night, we put her to bed and kissed her goodnight, and she literally opened her eyes, started moving her arms, legs, and crying. So I promised her I'd take care of her.
And so you had a background, as it turned out. You knew a lot about the brain.
Actually, I did. I was an undergraduate at University of Vermont, a zoology major, and I specialized in neurobiology. And I did research at the University of Vermont Medical School in the Department of Neurobiology. I studied nerve regeneration and plasticity in response to brain injury. And I was pretty well acclaimed for that. I graduated with honors and had other accolades in addition. So for various reasons, I pursued different paths, and in fact ended up at Northwestern's Business School, got an MBA, and went on to found some medical diagnostic computer companies and other companies, and ended up in the telecom industry when my daughter was born.
Mm-hmm. Now, your daughter has, we have some paintings that she has been able to do that are up on the website, and Ed was telling us a little bit about the paintings. That your daughter actually has some memories of heaven.
She does. To put it simply, and it's unbelievable, it came out when she was, actually came out earlier, but she cannot speak, she can't write. When she was in 3rd grade, she got a touchscreen computer at school, and her first assignment that she could complete was to write an autobiography in the fall time at school. So she was writing her autobiography, and she wrote, my name's Rebecca Marie, I'm 8 years old, I love my mom and dad. My brother Eric is a clown. I wish I was like Melissa, and that's because she has friends that come to the house and play with her. And I went to heaven through 2 big white doors. Jesus was there, told me to go back and teach people to pray. I have 2 cats, Tiger and Goldie, and I love to swim in the pool all summer long.
That must have been really an amazing thing for you to read.
Well, it was. One, we had kind of known there was something there, but we couldn't get it communicated. And then, but to see the details that she put in there, and it was all, everything was matter of fact, you know.
And one of her paintings you interpret as Scene of Angels.
Well, it's not what we interpreted. It's a painting, Angels, Us, Our Heaven, I think is the name. And we asked her when she paints, she has some help. You have to help with her elbow. And I think you have a picture of that. But she'll choose the colors. She'll choose the mixing of the colors. And then we'll dip her fingers in the paint, and then she'll do movements with the fingers. She doesn't do any other time. And some of them are kind of intricate when you look at the style, the texture of the painting. But she came up with one painting, and we asked her what it was, and she said it was heaven.
And as it turns out, we'll have another discussion about this, but I spent some of my career working on the arts and the brain, and there's some really interesting things. And art and music has enormous capacity where you think, to think the brain is just not functioning, and yet functions at a very high level when it comes to aesthetics. So it's just an interesting.
Well, she loves music. She has a blast with that. She enjoys her art, which is despite her physical limitations, her art is brilliant. But she's actually incredibly brilliant in math. She is just astounding.
That's great. So now you were trying to find some way of helping your daughter, and you came across the studies of hyperbaric chamber.
What it was in up until age 5, the first 3 years actually, we had given her mouth-to-mouth resuscitation 9 times. She was very frail. She had a lot of problems. After that, she had static grand mal seizures every month that would last an hour. I mean, it was just myriad things. There was no question at some point she was going to be hospitalized, and what happens with those kids, once they reach that point, they go downhill and they're gone. And at age 3, somebody gave me an article out of a magazine from South Africa about a father who was treating his son, who was a near-drowning victim, with hyperbarics. And I thought about it because I put everything back in the models that I knew, unfortunately, and I looked at that, and I said, that can't work. There's no way. I looked at it a little bit, but I just dismissed it. I kept on going down the road because things were getting worse for her. She matured, and I kept on doing all kinds of research, and the internet was making more things available. And I was looking at drugs. I was looking at drug therapies. There was a doctor in Florida that would treat stroke patients with drug cocktails, and that was the furthest I could go to figure out a way to help her, at least get some level of stability. And we were doing the physical therapies, and all that, but when you have all these other problems, they don't help as they should. And we were in Chicago, and I came across we were doing some conductive ed therapies, which are phenomenal for these kids. And I came across a paper at that time from 1978, and it showed me that the ischemic penumbra, that's the part of the brain that doesn't have adequate blood flow, that is reversible up to 7 years post-injury. And I saw that, and I thought about it. Oh, my God, this hyperbaric stuff has to work. And the question was, well, does it work a lot? Does it work a little? And at that point, there was not really a lot of information on the internet or any place for it. But I did come across 2 moms in that class the next morning. We were talking about it, and they said, yeah, we did hyperbarics for our kids, and they're phenomenal. One said, you got to go to Canada. The other said, no, the best doctor in America is in Florida. So we flew home a day early, and I talked to my daughter's neurologist, and 2 days after that, we're in Florida starting hyperbarics.
And since then, you actually explained quite well to me on the phone how it works. Can you explain the 2 ways in which it...
Well, let's forgetting the brain injury, let's just look at how hyperbarics work, because they're used for a lot of medical applications. But it's actually quite simple. Oxygen under pressure will dissolve the liquid part of your blood, and with that, it'll diffuse the places that the red blood cells can't get to. Well, that's interesting, but it's not everything. What it also does, it actually signals the DNA to release a lot of healing mechanisms. For example, it does cause new blood vessels to grow. For example, in diabetic foot wounds, where most people would have their amputations, whatever amputated, it resolves, even if they're the morning before amputation, it resolves 75% of those amputations so that they healed and the patient's much healthier. And it's through these mechanisms. It increases natural stem cells by 800%. Now, it's still a drop in the bucket compared to what if one day we can manufacture stem cells, but it's very helpful. It upregulates the immune system so it's stronger. It downregulates the autoimmune system so it's not so aggressive against the body. But mostly what it does, it truly affects the part of the cell that makes energy, the mitochondria.
Right.
Okay, that's where in every cell you have several or a number of mitochondria, and they make the energy. Now, for a brain injury, what happens, you do have an area that lacks blood flow for whatever reason. There's probably some tissue that's died in there. There's some tissue that's severely injured, and then there's other tissue that's more stunned than anything else. And there's a variety of mechanisms how that can happen.
And you're talking about neurons here?
In the neurons. We're talking about neurons and glia and all that, but just the neurons, really. And so what we find is that that is a mitochondrial impairment, which also translates into a lower blood flow to that area. When you think of it, when you think art, all the blood goes to the art side of the brain. When you think math, all the blood goes to the math side of the brain. Well, this part of the brain can't turn itself back on. And the way I explain it to people is if you're running across the parking lot with your legs, and a cell in your leg muscle is using this much energy, and you get a bruise on it somehow, and it only has that much energy, well, that muscle still works and it runs, but it's slow and weaker. But if you have a neuron that has that much energy, and it's stunned somehow and only has that much energy, even though it's so much more than a leg muscle, that neuron will turn off. It's the switch is off, and you can't turn that back on. So when people see these miraculous recoveries, somehow, some way, that blood flow is getting going again, the neurons are turning back on. What hyperbarics does, with all that oxygen flowing in the system, the easiest way to understand it is it supercharges the mitochondria. So now the mitochondria that are there are now making more energy, and then they replicate as well. So now the neurons will normalize the amount of metabolism they have, and so now they can fire an action potential, which is how they communicate.
Right. So now we have some still stores where we have taken some pictures of you have shown. Tell us what's on the screen.
These are number of these scans are from Dr. Paul Harch, who is the top physician in America, if not the world, on hyperbarics for brain injuries. Those are SPECT scans, and they show metabolism. In these scans, the color is meaningless. It's just an effect of the computer program, so ignore that. But you look at the brains, and they have like a fullness. There's softness. The female on the left side, the male on the right side, you see the male's got a slightly fatter head. So I like to point that out to women so they know why we're
that right along.
Yeah. So
we have medical sciences proving it.
Exactly. And then here's, for example, a 3-year-old female who has autism and a lot of CP, had a lot of CP symptoms. She couldn't walk, she couldn't feed herself, self-destructive, couldn't speak, etc. You can see the damage, the difference between that and the previous one, where you see underneath there's a very jagged edges of those parts of the brain. After 80 treatments, you see on the right how it smooths out. Okay, that's the normal. If you go back to the other one again, you'll see how the post-treatment, the brain has smoothed out. So now you've got, it's not that new tissue's there, because that's never going to happen, as far as we know yet. But what happens is that the metabolism, the blood flow is now normalized. And that tissue can potentially be active and supportive of the brain. With that girl, what happened is at the end of her 80 treatment, she was able, instead of not walking, she was able to walk with a walker, and several months after that, she was able to walk without the walker.
How many treatments did she end up having?
I believe she had 80 treatments.
Okay. All right, another slide up here.
This is a veteran from the Middle East. He had 3 concussions. And a lot of the symptoms you were talking about probably more exaggerated. Antisocial, could not sleep, could not verbalize things very well, anger problems, could not read very well anymore, math was very difficult, et cetera, et cetera. What happens is that they have a lot of good armor protecting them from the IEDs, but that percussion force hits the bone, goes through the bone, the hard tissue, and hits the soft tissue and shocks it. And so you see how jagged it is underneath, and obviously it doesn't look normal. Now, this is part of that was part of a pilot study for treating veterans. He was getting at that point he had half the protocol of 80 treatments, and it's at a low pressure, and you see the changes there. And essentially he went from being a disabled TBI veteran to being able to resume his duties halfway through the protocol.
Mm-hmm. Now, the results that we've seen here, and George Visker, who we've been dealing with, football player who swears by these treatments, why is it that hyperbarics is not more accepted in the medical community?
Well, I think that's the million-dollar question, if you want, $64 million question. You know, there's a lot of challenges. My perspective is that, from my background, the business side of things, is that we have a proprietary medical system, and so the system works very well for high-value proprietary drugs or equipment to go through, be approved, and then the profits from those products can go teach doctors. Yeah. Well, it's not just advertising. Right. We look at it as advertising marketing. It's actually education, supporting symposia, supporting studies, other things. And it's really a marketing. It's marketing to develop, but it's really the fundamental education.
Right. And we have another problem, don't we, with longitudinal studies and.
Well, there's a lot of issues. You cannot really do. If you look at disabled children, you see very few drugs ever tested on a disabled child. There's a lot of ethical and legal issues against that. And hyperbarics, believe it or not, is one of the drugs that's most tested and most effective for brain injured children. But there's a lot of pushback. I don't know if it's just the fact that neurologists don't like other guys who just put air in a canister or oxygen in a canister, or making these kids walk again, or not. But there's the neurology fields have given us a lot of pushback. But when you get a good neurologist and he sees the patient before and sees it after, he's on board, because the changes are stunning. When we went to Florida that first time, the last phone call I did before getting on the plane, my daughter, was I spoke to her neurologist. And he was adamant, don't do it, you're going to waste your time, waste your money, you're not going to get anything out of it, nothing's proven to ever work. He was on and on and on. And I asked him, well, is it safe? He said, it's perfectly safe. So I thought about it for a couple of minutes, and I thought, my daughter, my relationship with her, I thought, well, I was semi-retired at that point. I sold the business, international cellular business, and I thought, well, if I waste my time and I waste my money, I can deal with that. I'm in a comfortable position. But if I find out later I could have helped her, it'll be crushing. I'll kill myself. Mm-hmm. So we got on that plane, we went down there, and I didn't know quite what to expect, quite frankly. But we did the hyperbarics, and I can tell you, this is very subjective, but in that first treatment, now, this is with a child. It's not that she had very little coordination. She had no coordination. I think you might know what I'm talking about. She could not do anything. And I saw her in the chamber starting to move her hands smoothly, in the chamber. And it didn't really work the same outside the chamber. While she had the high oxygen level, she could move her hands differently. She was doing things differently. And within the first 3 days, she was able to swallow a thin liquid without choking for the first time in her life. Okay, now before the hyperbarics, she had static grand mal seizures every single month. Okay, they would last an hour, even in the emergency room. It was devastating, and that was for about 14 months. That was going on, and we went down there for a CP. We didn't even think about the seizures, but one of the benefits was she, after starting the hyperbarics, she went 6 years drug-free and seizure-free until she reached puberty. It was just incredible. So there's a lot of benefits there.
Let me ask you, Dr. Jensen, does this sound like something that might be useful for us to look at?
I think there's always, you need to keep an open mind in going through. I don't have a lot of experience with it with brain injury, but from a stroke standpoint, I know there have been longitudinal studies that they've looked at that weren't overwhelmingly supportive for it. And so that's the biggest trial
They were or were not?
Were not, that I saw.
Actually, it's very well supportive. There's a lot of studies. The problem we have in hyperbarics is almost all the studies are done invariably by people that don't know it. And so, for example, there was a study done by the military. While that pilot study was being very successful, 95% of the men treated in that study that were disabled with traumatic brain injuries went back to normalcy or near normalcy in 2 to 5 months. Okay, there was a similar study being done in Dallas at the same time. It was done at the wrong pressure. It was done at 2.4 atmospheres, and we knew beforehand that none of those people would improve, and we saw that none of those people improved. So its dosage and protocol is very important.
Right, and that's, I have not had a lot of training in it.
Exactly.
Not
There
had
you go.
exposure to it.
There's the-
I'm happy to say that. All I know is my experience and what I was taught when I went
Right.
to training on stroke. So,
Right.
I mean, I just, the fact that we just got 2 hyperbaric chambers here in Grass Valley, I think is we've learned a lot more recently.
Right, and and I think we don't know. Let's face it, part of the body that we know the least about is the brain, and
Yep.
I had one of my friends tell me that the 21st century is going to be the century about the brain. That's where the exploration is going to be. So I guess the reason we've asked Ed to come aboard is because so often you hear people say, "Well, there's nothing you can do. It's only time, and time will tell," and so forth and so on. And I guess for parents of severely injured youngsters, I mean, you got to give them something to look at, and hopefully, there'll be other regimens. Are there any other things that you guys would want to mention that you would say is a treatment regimen for TBI?
I think the best thing is, and I'll promote speech therapy briefly, is that I think speech therapists that are trained in traumatic brain injury can guide a family and guide a parent. They've got more time to spend with them than just about anyone else that is covered by insurance, and that's a key thing. We look at neuropsychologists, we look at other alternative treatments. It's very expensive, and parents take a lot of time off work to care for kids. Fortunately, in this situation, you are in a position where you can do that, but I find most families struggling from a financial standpoint.
It's brutal. That is the greatest challenge for families, because now you are down to one income, regardless of what you want to try to do, and you have a lot of, even if it's covered, if your treatment, medical care is covered, you still have the co-pays that accumulate when you go into doctors or 3 days a week. And then you have the stuff that is not covered, and
the parents aren't working, and
exactly
they're caring for their child, and so what can we get through insurance?
Right.
That's the great challenge.
We got about a minute left here. Believe it or not, that's the fastest hour in TV. I want to thank my guests for coming on, and we will probably ask you to come on again at some point as we develop the series more. And I think, as I said before, this is about education, and the more awareness we can bring to the general public, the more we're going to impact parents and children as well. So, as I said, this is the 4th in a series on TBI, and that's all we have time for tonight. So I'm going to say bye-bye until next time.
Thank you.